Lillian Smith is a 72-year-old Native American woman diagnosed with congestive heart failure, atrial fibrillation, orthostatic hypohydration syndrome, and nocturia. She reports occasional shortness of breath and mild lower extremity swelling, but remains active and independent in her daily activities. Lillian's main concern is maintaining her independence and staying healthy enough to continue her daily walks, gardening, and volunteer work at her local travel center. Lillian was born and raised in Montana, where she still resides with her husband John of 48 years. Together they have 3 adult children and 8 grandchildren who live nearby. She worked as a high school history teacher for 45 years and continues to be deeply involved in her community through teaching Native American history and culture to children and young adults. She practices both Christianity and traditional Native American spirituality, attending a Methodist church weekly and participating in tribal seasonal ceremonies. Lillian values independence, cultural connection, and a natural lifestyle. She does not smoke, she drinks alcohol occasionally, and maintains a diet rich in vegetables that she grows from her garden. Lillian has no cognitive impairments and manages her medications and daily routines. She prefers to remain at home and prioritize her quality of life with her eldest daughter, Sarah Smith, who she has designated as her healthcare power of attorney. Lillian presents with stable congestive heart failure, but remains at risk for fluid overload and fatigue. Her atrial fibrillation is currently controlled with medication. She has a history of orthostatic hypotension and dehydration due to active outdoor work and limited fluid intake at times, as well as nocturia, which disrupts her sleep. She is currently taking furosemide 40 milligrams by mouth daily in the mornings, lisinopril 10 milligrams by mouth daily, metoprolol 50 milligrams by mouth daily, digoxin 0.125 milligrams by mouth daily, apixaban 5 milligrams twice daily by mouth, fludrocortisone 0.1 milligrams daily by mouth, desmopressin 0.1 milligrams by mouth at bedtime, and Norco by mouth every 6 hours as needed for pain. She has no acute distress. She's alert and oriented times 3. Her blood pressure is 118/72. Her heart rate is 68 beats per minute. Respirations are 18 breaths. Her oxygen is 97% on room air. She has mild pedal edema +1. She denies chest pain or palpitations, and she reports waking 2 to 3 times in the night to urinate. She has no recent falls, and she is independent in her ADLs. Due to age-related physiological changes, Lillian metabolizes medication slowly, increasing her risk for toxicity. She benefits from large print medication instructions, a consistent pharmacy, and regular electrolyte and renal function monitoring. Her strong health literacy and cultural pride promote adherence to care plans. Recommendations are to continue current medication regimen with ongoing monitoring of kidney function, electrolytes, and heart rate, reinforce the importance of daily weights and reporting a weight gain of greater than 2 pounds in 24 hours or greater than 5 pounds in a week. It is encouraged to continue a low-sodium, heart-healthy diet and hydration throughout the day with limited evening fluids to reduce her nocturia. It is suggested to use a bedside commode with a nightlight and grab bars to prevent falls during nighttime bathroom trips. Should provide education on the signs of medication side effects, especially digoxin toxicity and bleeding that can be caused from the apixaban. Or recommend routine follow-up with cardiology and primary care every 3 to 6 months. Support ongoing preventative health measures, including flu, pneumococcal, shingles, and Tdap vaccines. Encourage continuation of cultural and spiritual practices as protective health factors. Document advance directive and ensure healthcare power of attorney for Sarah Smith is up to date, and reassure functional status, medication tolerance, and fall risk at each visit.